So as I was trying to share with you, change, we are saying that it is an ongoing process whereby it involves many entities in terms of structures, functions, and etc. in either in a family or in an individual, or you can talk of a community or a society. Now, what about change in health and nursing? So, change refers to the process by which individuals, families, or communities adapt new health behaviors, and you are able to modify lifestyles, accept innovations for improved health outcomes. Now, in change, by definition, in organizations, we can say is a planned or unplanned transition from one stage of functioning to another in order to promote efficiency, productivity, and relevance. So we are talking of transiting from one state to another state. And sometime, basically, you can have a change necessarily about efficiency. Sometimes, even this efficiency can be lost if you are not careful. So when we are having a change, we need to be very cautious at all costs so that at the end of it all, it has got a good results to the individual, to the family, and the community at large. So we have got various or nature of change. So sometimes we can say that change is inevitable and it is universal. So change is a constant in life, health, and society. Also, we can say another nature of change is that it is multidimensional. It affects physical, social, emotional, economic, political, and spiritual domains or components. Also, we can say change is contextual. So, by saying that change is contextual, it is the impact of change. It relies on cultural, social, and economic contexts. Another thing we can say that change is dual in nature. It can be constructive or it can be destructive. Either way, at the end of the day. So we have got types of change. We have got types of change. So we have got numerous types of change. There are around five in regards to community health. Let us have Ashley Oma, types of change. You can read for us.
Type of change, planned change, deliberate and goal-oriented. In nursing, health education interventions, e.g., smoking, e.g., smoking, cessation programs. Number 3, in organizations, adoption of new technology policy reforms. Number 2, unplanned change, spontaneous change, unexpected, often disruptive, e.g., sudden diseases, outbreaks, disasters, or pandemic. Number 3, development changes occurs as individuals or family progress through life stages, e.g., transition to parenthood or menopause or ret- ret- retreatment. Number 4, transitional change, shift from an old process or to a new one, e.g., moving from manual patient records to electronic health records. Number 5, transformational change, radical or comprehensive shift that defines structure, value, or identities, e.g., health system reforms or global health movement like UHC, universal health coverage.
Okay, thank you, Oma. So those are some of the types of change that you can have. Planned change, you as a nurse, you can develop. You can develop a program whereby you want, maybe you are talking of smoking cessation program. That is like planned. You just sit down and then you design that particular program for the benefit of your client or a patient. That is planned. Or even it can be in form of physical fitness. You want to have a physical fitness program in your area of service delivery, maybe for your patient. Then there is another one. They're talking of spontaneous. It just occurs the way it is, like outbreaks of diseases. When you're talking of outbreaks, is like when you are having conditions like measles, we have got conditions like cholera. When they come, they bring a lot of changes. We will find that this patient, once, for example, there is a measles outbreak, and they have been, the Ministry of Health has appreciated that there is indeed, there is this particular disease in a particular area. So we normally talk of quarantine. You see, it brings a lot of derangements. And even if you can be able to recall, in 2019, when we had the COVID-19 outbreak of COVID-19 disease, we had many derangements in relation to health service, whereby you could not be able to move from one area to another area. And even we had this particular roadblocks, whereby you are supposed to identify yourself. If you are providing essential services, if you are a medic, it is the time you could be allowed to move from one point to another. But if you are just a layman or any other person, you are not allowed. So you can imagine of a change, how it can be able to bring a lot of havoc in our in this, environment. And then you have got developmental change. This one occurs specifically to you and even to me, from the time when you are born in that particular manner up to this particular level where you are. So that is just transit. You are trying to transit from childhood, you move to adulthood, adolescent. We have got those transitions up to the elderly. So that is what you are talking of developmental change. And even sometime we normally talk of now after becoming an adult, you transit now. You say that you want to be, maybe you want to marry. That is transition. That is like you are trying to transit from one point to another, and it has got its own. They are talking of dual consequences. We can have the positive consequences and the negative consequences, and all of them they are on board. Now we have another one here: transitional change. So this is just it happens in our daily life. For example, moving from manual patient records to electronic health records. Even at the moment, this is a transition in health. What we are doing, what we are trying to embrace at the moment is what we are referring to transitional change, whereby we used to have physical face-to-face teaching of students at different levels, but at the moment I can be able to share with you via this particular online teaching, whereby I can be able to hear from your side, you can be able to hear from you. So this is just a transitional change. It is called blended learning, whereby we are blending physical and online teaching. Then another change we have got the transformational change. Transformational change that referring to it as it is radical and comprehensive shifts or change that redefine structures, values, and identities. For example, in the Ministry of Health, we are trying to embrace what we call universal health coverage. Now, when we're talking of universal, it's global, it is worldwide, whereby we have got different governments internationally, they have come together and they are trying to embrace health for all. Even if you are from a particular area, even if it is remote, it should be health for all. Now we have got some of the theories and the models of change. Now, when we are referring to a theory, these are some of the ideas that were that have been recommended by some different authors who have come up with some statements that are in line with the change. They are trying to complement. They are trying to give us a leeway in which change can be able to occur. And some of these people, you can be able to see them. They are here. The first one is called Lewin's change theory. Our first model is called Lewin's change theory or model. Barasa, Crispin Barasa.
So the first one is Lewin's change theory, which is also called unfreeze change refreeze. So unfreeze is for preparing for change by creating awareness, change, implementation and adoption of new behavior, and refreeze where there is stabilizing change through reinforcement. The second one we have Rogers' diffusion of innovation theory, which explains how new ideas spread in a community. Categories we have innovation, we have innovators, early adopters, early majority, we have late majority, and we have the laggards. The third one we have the Prochaska trans-theoretical model. Into bracket we have stages of change. First one we have contemplation, then to contemplation, preparation, action, to maintenance, then the last one you have termination. So the fourth one you have lipid theory of change, which in bracket seven phases. So we have it emphasizes role of change agent in diagnosing, motivating, and maintaining change.
Okay, thank you. Thank you so much. Thank you so much, Barasa. So these are some of the models that are being utilized in the health sector or in the nursing fraternity that are guiding us on how change can be able to occur. And if you look at these particular models, each and everyone was having his or her own narrative of way in which he will be able to view change. You see, Lewins is talking of unfreezing, and then there is change, and then you freeze, and then refreezing. Now, when you're looking at when you look at Rogers' diffusion, he's talking of initially we have got those one who are able to innovate. And then from that particular innovation, we have got some of these guys who can be able to adopt early, and then we can have a big number of these particular people who can be able to adopt this particular change. And then as much as we have got those one who can be able to appreciate that particular change in the initial stages, we have got also others who can be able to also later on will be able to um, be able to adjust to the new way of life or doing things. In that particular manner, also we have got the other one. They call the Prochakas. This one is talking of how you are talking of pre-contemplation, thinking about it just before that particular change occurs. What is there? What do you have about that particular change? Then after that, you try to think about it, and then you prepare yourself for the change. And then from there is what you call implementation. Now, after implementing, are you able to sustain? When you are talking of maintenance, maintaining is about trying to sustain that particular change to the ladder, and then termination. And lastly, we have got the Lipid's theory of change, whereby uh, he was trying to explore in terms of trying to ensure that you diagnose that particular change, then you get motivated, and then you can be able to maintain that particular change. Now we have got forces driving change. We have got the internal forces and the external forces. Now, under internal forces, we normally look at the needs, values, aspiration of individuals and groups. And then we need to have a vision. We need to have leaders. Now, in relation to this, we can have satisfaction or dissatisfaction with the current state. Now, shifting gears to external forces, we have got globalization. It's also another driving force that is there behind change. Then we have got technology. The way I have already mentioned here, we are trying to embrace change through technology by teaching via online. And then you have got policy changes. This one comes when you have done a research and then you have got evidence. Is when you can make a change. Then even also we have got another thing called epidemics, outbreaks of diseases. These are just external forces. Now, in addition, we have got the government formulation of laws. Yes, there are driving forces behind change, and this one you can be able to, because each and every law the government is able to sit down, formulate, discuss, and then at the end of it all, they agree and it is appended by His Excellency the President. It will be able to have an impact on any change that is occurring. Then also we have public health campaigns and international trends. So these are some of the things that can bring about change. Then we have barriers to change. We have got some obstacles that can be able to hinder us to be able to attain a particular change. So Collins Makoha, can you read for us? Collins, are you in?
Yes, I'm in.
Okay, you can read for us. Forces, no, not forces, barriers, obstacles to change.
We have one, psychological resistance. It talks about fear of unknown, loss of control, and anxiety. Then second, we have cultural resistance. Talks about norms and tradition, opposing new practices. And the third one, we have social resistance, peer pressure, group conformity. Then lastly, we have organizational resistance. Talks about bureau- bureaucracy,
Bureaucracy. Bureaucracy.
bureaucracy, in, inadequate, uh, inadequate resources, and poor leadership.
Yes, thank you. Thank you so much, Makoha. So those are some of the barriers. As much as we might want to have change in a particular space, yes, we have got to also be ready for some resistance for particular change. It is not easy as you might think. For everything that you want to bring any change, you shall have these particular obstacles on your way. So you need to work to be smart enough for you to be able to navigate this particular to navigate over these particular barriers. Now we have got strategies for managing change. Faustin, Jebet, are you in?
Yes, I mean,
Okay, you can read for us strategies for managing change.
we have education and communication, that is creating awareness to reduce resistance, participation and involvement, engaging stakeholders in planning and implementation. We have support and facilitation, counseling, training. Then we have negotiation and agreement, compromise to win acceptance. Then
Coercion.
co- coercion, last resort, enforcing policy or legal frameworks.
Yes. So these are some of the, thank you so much, Jabet. So these are some of the strategies that you can be able to use in order to overcome resistance to change. You need to create awareness, you need to involve people, you need to ensure that there is capacity building. For you to be able to attain this particular change, also you need to negotiate. This is also just about you coming there and then you want to impose change to people. So we need to agree. And this the last resort they are talking of coercion, just enforcing policy or legal frameworks for this particular change to occur. So we have stages of change in nursing, stroke community practice. So this one is also, it is just borrowing the application of the nursing process. I know you have learned it in medical surgical nursing, the nursing process, where you normally talk of the ADPI. Now, also, it is also the same concept is also applied in community health nursing, where you are talking of we need to have assessment, planning, implementation, and then lastly, stabilization. So you can be able to see there is another component there. They have introduced stabilization. Now, we have got change in the context of health and nursing. George Alubala.
Okay, change in the context of health and nursing, individual
Yes.
level, lifestyle modification, is diet, exercise, adherent to treatment. Then we have family level, role shift, caregiving, health seeking behaviors. Then we have community level, acceptance of new health initiatives, which are vaccination and sanitation. We have organization level, where we have which is the adoption of evidence-based practices. Then digital health. Then we have policy level, where we have national health reforms, insurance schemes, UHC and PHC.
Okay, thank you. Thank you so much. That is George Alubala. Thank you so much. So changes in the context of health and nursing. We normally talk of the at the level we can have change, whereby if you are unhealthy, you can look at lifestyle modification in terms of diet. You need to have physical fitness. And then we have got the family level, right? So under family level, we have the issue of role shifts in terms of the care we give to to our family members, and then also health-seeking behaviors. Now, when you're talking of health-seeking behaviors, it's about especially you will find that in this much many of the families will find that there is health-seeking behaviors for women in a particular family is good as opposed to men. Men tend to be sluggish when it comes to health-seeking behavior. They try to ignore, and then we have got also in the context of a community level, we need to have what we call acceptance of new health initiative. So for us to, we have got some areas, for example, in our country, when we are they are trying to give what we call this particular immunization or vaccination to children. You will find we have got some areas where we have got some guys who are not ready to accept this particular the idea of vaccination. They normally talk of, in fact, even in Catholics, they normally talk of family planning. It is not allowed. I don't know if you have got Catholics in this particular forum here, if they can be able to tell us if it is true, but it is true. We will find that under faith-based organization, especially those ones that are owned by the Catholics, you will find that those particular facilities they don't offer this family planning, especially in women. they are talking of we need to have we need to have the multiplication to continue. They are not interested in family planning. I don't know if I'm wrong. And then also under organizational level, we have adoption of evidence-based practices, digital health. So it is very paramount to appreciate this particular concept of digital health, whereby you can be treated from wherever you are, as far as in that particular remote area you are living in, but you can be given treatment at your comfort zone. And then we have got the policy level. Policy level. So under this one also we have got this is another context where you are talking of national health reforms in terms of SHA, universal health coverage, and primary health care. So these are all that is also another sphere or another space in which we normally have change. We have got Marion Duda. You can read for us implications of change. Marion, are you in?
Yes, I mean,
Yes, you can share with
so
us.
we have positive outcomes, improve health outcomes, efficiency, empowerment, and
Innovation.
innovation. And then, yes, and then we have
Continue.
negative outcomes, stress, resilience, cultural conflicts, and inequalities if poorly managed. Then we have ed- ethical
Ethical.
dimensions.
Mhm.
Ethical dimensions. Change must respect dignity, autonomy, and justice. Yes, I'm
Okay.
done.
Thank you. Okay. Thank you so much, Luda. So these are some of the what it implies when we are talking of change. You can have positive outcomes. You can be able to see they are there. We have got negative outcomes, and then another element. As much as we are having either positive or negative outcomes, we are supposed to be ethical when we want to bring change. That is why I was talking of creating awareness, education as a strategy. We need to have respect. Even if you want to bring change, we need to have sanity so that people can be able to accept that particular change. And you shall have no resistance to change. If you are able to embrace this particular ethical dimension as far as change is concerned, then at the end of it all, you'll be a successful person.